Aquablation has been added into our armamentarium for BPH treatment almost 1.5 years ago in fall 2017 actually. And we offer it as a routine treatment to all patients who are not under anticoagulation seeking interventional treatment for symptomatic BPH actually. The benefits of Aquablation as compared to TURP are pretty obvious when you look at the outcome data. First of all, it's more or less independent of surgeon's experience. Aquablation has, like every procedure, has a learning curve, but since the removal of the tissue is robot executed, you just have to learn how to handle the system, how to do the planning correctly, how to identify the BPH tissue, which is daily urological routine. Every urologist can read an ultrasound of the prostate. And then the surgical part is executed by a robot. So other than in TURP, where you are depending on the learning curve and the experience of the surgeon, you don't have that in Aquablation, where the learning curve is not that prominent actually. Second, it's OR time. So when we have now treated over 250 patients in my department, and what we see is that independent of prostate size, we have an average OR time of below 20 minutes. So anesthesia time is only half an hour. When we compare it to patients receiving TURP or laser enucleation or laser treatment in my department with the same prostate size, we have an average OR time of approximately an hour, which gives us an anesthesia time of an hour 15, an hour 20. So the time where the patient is under anesthesia and where the surgery is performed is shorter, makes it even more minimal invasive than the minimal invasive treatments we already have. Furthermore, in Aquablation, we work completely athermal. So of course, when we remove the tissue, we create a wound, and this wound will need some time to heal. Yeah? But when you imagine when you cut your finger and when you burn your finger, and what we do with all other methods, basically that we create a burn of the surface, we all know that a clear cut hurts, it will take some time to heal, but it hurts less and it heals faster than a burning wound when you burn your finger. So the patient's recovery and return to daily routine activity is much faster after Aquablation as compared to all other methods.